There are lots of reasons that patients come in for something like an abdominoplasty, aka tummy tuck. The main issue is that patients have excess abdominal skin and they want to get rid of that skin. This can be because of massive weight loss. It can be a result of having children, or it can be the combination of those two things. There are a lot of different variations that happen with planning for abdominoplasty, aka tummy tuck. There's concepts of mini, full, circumferential, 360, tummy tuck with lipo, tummy tuck with muscle repair or not. And what we want to do is talk about kind of how do you delineate and break those down. One of the big things is going to be identifying kind of what the issue is and what the goals are for you as a patient. Most of the time, it's to get rid of the extra skin, but it's also a combination of getting rid of extra fat, potentially fixing your core, tightening the muscles. And in other situations, it could be a situation where you want to actually take care of other parts of your body at the same time. So when we think about this, we need to essentially think about looking at you as a 360-degree 3D object. So when I see a patient, it's important to note that obviously, yes, when you look in the mirror, you see your tummy, but we need to make sure that it's not just the tummy that you're concerned about. Sometimes you're concerned with your lateral thigh or the area right on your sides, the flanks, and sometimes you're actually concerned with the tissue above your buttock. And so when we think about this, when I see a patient in consult, that's what we'll walk through. So a patient comes in and is concerned about their tummy. They have an old C-section scar, or they have massive weight loss and the skin's hanging over. We understand that we need to get rid of this extra skin. We understand that we want to be thin, flat, and tight, and that if they've had children or if they had a ton of weight loss and now they have a pooch afterwards, that when they lay down goes flat, that they need to have their muscles repaired. One of the things that's important to note is when you do repair those muscles, not only does that give you a stronger core, but it shapes your body. It gives you an hourglass figure, and then it flattens you. When you look at your side in the mirror, it keeps you flat, and you don't have to hold it in all the time. So that's something that we do with almost all abdominoplasties. Doesn't mean you have to have it. There's situations where patients have not had children and the core is totally intact and we don't have to mess with it. Sometimes patients will ask, what if it's a guy? A guy can have muscle repair also, but the likelihood is lower that he would need that. So when we do this, we actually tighten those muscles and then get rid of all the extra skin. Now, determining the length of the abdominoplasty is something that a lot of patients are worried about. They're like, Doc, I just want to have the smallest scar. Well, I'm going to tell you that if you have a lot of extra skin, you're not going to get a good result with a shorter scar. So if you do like a mini abdominoplasty or a abdominoplasty where you're not taking it further out, you're likely going to have an inferior result if you have extra skin in this distribution of your flanks or above the buttock. In those situations, you need to do something called an extended abdominoplasty or potentially a circumferential abdominoplasty, because at the end of the day, you're going to have a better result, better shaping, and get rid of all that extra skin. It's a shame when patients come in and they have a great result anteriorly, and then posteriorly, they're like, Doc, I hate this extra skin back here. And so it's important for you to be educated that depending on your body and what's going on and what your goals are, you may need to have a longer scar to get that addressed. Sometimes patients will ask, can I just do a mini abdominoplasty? I don't really want that scar around my belly button, and I just want it to be in a C-section distribution. Well, the truth is not many people are great candidates for a mini abdominoplasty. I'm not saying a mini abdominoplasty is a bad operation, but if you use it on the wrong patient, you'll get an inferior result, and then you'll have to have a revision in the future. So we want to try to avoid that. The perfect candidate for a mini abdominoplasty is someone who's pretty thin skin, who just has excess below the belly button predominantly and has a muscle separation or a pooch. If there's a lot of extra skin up here, you need to remove more skin to treat that. When people have a mini abdominoplasty and it's improperly selected, they sit down and they have a ton of extra skin here and they hate that. So just be cautious in doing this. Again, an in-person consultation is very important to really figure out what's best for you. But what I can tell you is picking a lesser grade intervention doesn't necessarily get you a better result. It might have less scar, but you might be more unhappy with that. So it's important to think about this. Another thing is going to be, when do you do liposuction with an abdominoplasty? Almost every abdominoplasty that we do, especially at HKB, will typically add liposuction in one way or another. Sometimes we're just doing a full abdominoplasty and we're just going to liposuction the flap itself. Sometimes we're just going to liposuction the flanks. Other times we're going to do full 360 liposuction. So people say, when should I get considered 360 lipo in an abdominoplasty? And I think that's, again, depends on you and what you're concerned about. But getting that shaping all the way around when you do the front, the sides, and the back is when you get the most enhanced aesthetic result, and I think looks absolutely elegant. So it's important to note that sometimes you're going to get one part, just an abdominoplasty. Other times you're going to get abdominoplasty, muscle repair. You're going to get hip roll liposuction. You might get full back liposuction. You might get energy treatment. You might get skin excision. You might get a bra line back lift. These are all a lot of things, but again, it's very unique to you, and you need to come in so we can critically evaluate you according to what your goals are and help orchestrate a plan that'll help you achieve those goals.